Excellent. Thank you, everyone, again for attending. My name is Matt Lopez. I'm the Regional Sales Director with Levo Medical. Happy to have you on today for our webinar, Improving Acoustic Stimulation Outcomes with MyLevo. I'm pleased to introduce our panelists today. Dr. Daniel Drexler, who's a clinical director and original founder of the Levo system. Runs a tinnitus clinic in Montevideo, Uruguay, where he's had many years of experience with Levo and sound stimulation at night, and happy to have him join us today with our conversation. Also including us, joining us today, Dr. Kelly Breese and Dr. Megan Bradshaw, both very passionate about tinnitus management, and very excited to have their conversation today with us. Kelly joins us from Sarasota, Florida, and Megan from Chicago, Illinois. So thank you very much again, all three of you, for attending and joining us today for the webinar. Before we introduce our panelists today, I would like to provide just a brief overview of the Levo system so we're all on the same page here. So again, the Levo system is nighttime sound stimulation based on the replication of the patient's own perception of sound. So the system is made up of three different parts. For you, the provider, there is a manager programming device, which is on an Apple iPad. Patients receive the iPod Touch and the Levo software on that device, along with high fidelity custom earbuds that are specifically designed for the clarity of the sound, again, high fidelity and no bass. So three components of the system. And again, it's based off to facilitate habituation, neuroplastic mediated changes based on that acoustic stimulation at night and the replication of the patient's own perception. In terms of the therapy timeline, what we suggest is typically about a 9-month protocol, broken down into a few different phases. Adaptation phase, where the patient is getting used to the therapy, wearing earbuds at night, calibrating the volume correctly. So that can span anywhere from a couple of days to a couple of weeks. And then they get into that continuous stimulation phase, where they're continuously listening to the therapy on a nightly basis for roughly 5 to 6 months of time. And then that detachment period, where patients are weaning off the device and tapering down from listening to it every night to every other night, every third night, until they no longer need it. If patients do need to start the therapy again after the initial protocol, they can certainly start the therapy up, but would not need that necessary 9 months of activity again to listen and get back to that baseline of where they were when they left when they stopped the therapy. The programming device allows you, again, to replicate what that patient is suffering from in terms of their type of sound, their pitch, their volume. So through some various steps, interactive steps with your patient, you're able to identify which sound they're suffering from, whether it be a tonal sound versus an atonal sound. And then you can refine that match by increasing or decreasing the pitch, the volume, the clarity in some sounds, and then also being able to intermix those sounds and blend them in to make a unique replication. So again, the idea is to get as close of a replication as possible, and then the patient would be instructed to listen to that external stimulus on a nightly basis at the same level as their perception each given night. When patients do come back for follow-ups, you do get a bit of data logging, so you can observe their data usage, how often they're using the device, what hours of the night, as well as an evolution report of their volume. So hopefully see a nice downward trend in that throughout the course of therapy, along tracking their TFI questionnaire results as well. So again, quick overview of what the Levo system is, but this webinar is more intended to talk about our new online learning platform, MyLevo, and the importance of counseling in addition to sound therapy. So at this time, I'd like to introduce Dr. Daniel Drexler. Going to go over just a quick points on some advantages of Levo, and then talk about how he implements that into his own practice and the use of counseling tools like MyLevo. So Daniel?
Hello, thanks, Matt. Thanks, everybody, for your time. Well, the first thing I'm going to say is, what are the two main advantages of this system? And we can group them in two different groups. One, first, those related to the type of stimulation that we use. And the second group is that this acoustic simulation is performed during sleep. Regarding the type of acoustic simulation, we use a very precise sound that reproduces the frequency and intensity components of the tinnitus of the patient. We call this sound individualized acoustic receipt, and it's like an acoustic fingerprint. It is different for each patient, and we strongly believe that it's more efficient in inducing neuroplastic mediated changes in the auditory pathways and also in the cortex and in the association areas of the brain, in order to reduce the intensity perceived of the tinnitus. We achieve very sharp reductions of intensity of the tinnitus of the patients using this kind of acoustic stimulation type. And the second group is the fact that this stimulation happens during sleep. During sleep, there's no single unit in the auditory pathway that stops processing information. That means that while we sleep, we still keep on hearing and processing the information that is around us. And this gives us a very wide window of opportunity for delivering our acoustic simulation up to 8 hours. It doesn't interfere with the daily activity of our patients. And during sleep, there's less competition with our other inputs, other sensory inputs, because while we are sleeping, for example, we are not using our eyes and we are not using our proprioceptive information, or there's less information from the proprioceptive side and from the eyes. So the brain gets more focused on the information we are delivering during sleep, and also the patient is not aware of the stimulation while the stimulation is happening, which reduces the anxiety related to the therapy. So we achieve really good results in the improvement of quality of sleep using this system. We achieve a sharp decrease in the TFI subscale for sleep. And also, all of us who treat patients with tinnitus know that sleep is an issue for our patients, and especially the moment before they go to sleep, since the surrounding sound level gets lower and the tinnitus goes to the foreground. So having a tool that helps our patients to navigate this really complicated moment of the day is also very useful. Next one. So in the last 10 years, we started adding counseling as a part of our therapy. And we all know that counseling combined with acoustic simulation shields the most promising tinnitus treatment results. There's a lot of information coming in the last 10 years about the importance of counseling and different approaches like TRT and CBT, and they try to achieve this kind of mixing of acoustic simulation with counseling. So we had a very long experience with our patients here in Montevideo. We made a lot of webinars via Zoom and also presential meetings, group meetings, and all this information, we tried to resume it in a system that we are launching this year. We launched it 2 months ago. That is called MyLevo. It's a platform for learning. It has a lot of contents inside. They are very short contents. They are easy to understand by the patient. And they give a lot of information that we usually give to our patients during the meetings, but it is also important to repeat this information, and also has a lot of training practices that the patient uses to do along the therapy. So we are very excited about this new system, and we are now trying to introduce it to you.
Thank you, Daniel. Appreciate the content there. And before we get into some details of MyLevo, I'd like to introduce both Dr. Megan Bradshaw and Dr. Kelly Breese back into the panel. Thank you both for joining us today.
Absolutely. Thanks for having us.
Absolutely. Hi. I want to start with, let's start with you, Megan, if you don't mind. If you can just share a little bit about from your experience. I know every patient is different when talking about tinnitus, but any basic elements that are required for successful tinnitus therapy in your view?
Sure. It is a passion of mine, first off, to hear the story and the history. So really getting an understanding of where they've come from, when it turned on, just a background, what medical things they've gotten to rule things out. I feel that part of healing is feeling. And so really getting the opportunity to listen well and to then intertwine counseling and education, because knowledge is power. And that's where this MyLevo system, I see, just complements so much, an excellent device with the educational piece that kind of reinforces a lot of the counseling that we've already do when we're one-on-one with our patients. And then they have this tool to refer to as they're going along with the treatment process. So that's just a brief summary of it.
Yep, appreciate that, Megan. Kelly, anything to add?
I would agree with everything Megan had to say. I totally think education is super important when you're trying to work with tinnitus, and having this extra counseling tool is just, I love it. It's so great because it's just the extra reassurance. I kind of always relate it to, you know, if you're wanting to build muscle, you can work out and lift weights, but sometimes you need to take some supplements to help with the muscles in the body to kind of regenerate and build. So I feel like that's kind of a way I associate the tinnitus and the counseling tools. You know, it's, you have the treatment to do the exercises, but you need that extra assistance, the education, the counseling to really help pull it all together.
Excellent. Excellent. No, definitely good positive feedback there. With in determining the approach to your tinnitus patients, if you don't mind walking through, Kelly, kind of your approach with a new tinnitus patient, how do you determine and evaluate what would be the best course of therapy for them?
Great question. So I, like Megan, think it's super important to get an in-depth case history, really get into as much as possible with noise exposure, the onset, if they know it, what potential causes could be a part of the tinnitus. Obviously doing a full audiologic workup, doing a few tinnitus assessments. A big one for me is, can they sound match it? You know, can they describe their tinnitus? Is it something that only fluctuates in volume, or is it something that, you know, one day it's a buzzing, the next day it's a chirping? Like that would rule out anyone for Levo devices. So if someone's like, nope, it's a high pitched constant, maybe sometimes it'll be less or louder, then I'm definitely like, we're going to sound match this out and see if we can do this. And typically the candidates that can hit it on the head fairly quickly, I'm like, all right, yeah, you definitely would benefit from this. And of course, the level of loss, we want to make sure that it's not too severe where they won't hear the sound.
Absolutely. Absolutely. Daniel, anything on your end that you'd like to add regarding, you know, onset of tinnitus, a new patient? What is your approach with them? If you can talk to us a little bit about your approach at your clinic in Montevideo.
Well, we really do a very extensive clinical record of the patient. We ask a lot of things about which was the onset, if he has any kind of exposure to sound, which are the other conditions that the patient may have, like, for example, blood pressure or metabolic issues that may interfere with tinnitus. We ask all this. We also we have a very long part of our first meeting asking the patient about how he eats, how he sleeps, if he uses structured sleeping, if he uses a lot of, for example, if he smokes, if he drinks coffee, if he takes something that's very usual here in the South, that is the mate. Those are things that tend to activate the basal metabolism of the central nervous, and the tinnitus tends to get worse when you use these kind of things in your diet. So we are really, we go deep in asking about those issues and try to instruct them not to use so much coffee, not so much drinking, not so much smoking, especially during the therapy. And of course, especially we have a long interrogation about how does the patient sleep, how many hours, if he has any kind of pills, and if he has a regular time for going to sleep, because there are patients, for example, that work during the night. So one day they sleep at 4 o'clock and the other day they sleep at 12 o'clock. So it's kind of mess, and we try to get them to sleep in a steady way. I may say that those are the most important questions that we make.
Yeah. Megan, I know
of course,
go ahead.
Of course, an full audiological profile with
Sure.
audiogram, high frequencies, impedantiometry, orthoacoustic emissions, loudness discomfort levels, and the acoustic.
Megan, I know they touched on a lot of things. Anything to add to that particular topic there?
Yeah. The other thing I would add is a somatosensory screening. I work closely with a physical therapist. And so just seeing if the tinnitus changes with head turns and jaw movements, and discuss if the patient knows any time where they can create that improvement. Definitely for those patients that have more normal hearing, they can be ideal candidates. Any patients that are struggling to sleep. But I definitely see a case where if patients have been using devices and auditory treatment and habituation therapy and are not where they want to be, I do think the LEVO system is something that can be very well worth trying. And there is that trial period. And I think sometimes that even if you can't get that perfect match, if they can still find that signal that can cover it up, I think you can see, as I'm thinking of a case, some really good outcomes of real improvement related to the intensity of the tinnitus, and even reports of not even hearing the tinnitus. So definitely proceed with caution and create the education. But I think that there is a wider range that can be utilized, especially if some of the traditional ways we're not getting the full benefits that the patient wants.
Excellent. All very great points, and thank you for the feedback there on that. You mentioned this both in your answers, but maybe we can talk a little bit more in detail on where I know there's many different options and great therapeutic options for tinnitus patients. When it comes to LEVO systems specifically, where does that fit in your tinnitus toolkit? Are there specific patients that you identify that are better candidates than others? Megan, I'll start with you if you can kind of go into more detail on that.
Sure, definitely patients that are struggling to sleep in any way, patients that have normal hearing. Those are two that probably are, and definitely, as Kelly touched on, people who can pitch match very clearly that signal, and you can find that. And the nice thing is the iPad for the LEVO system, you can play it out of the speaker and really can find that quite quickly if you can find that signal that can match. So patients that are motivated to want to wear something during sleep. There are patients that don't want to wear something during the day, and it might not be as indicated that their struggle is really the sleep at night. So those would be focuses for when that would be my first go-to.
Excellent. Excellent. Kelly, anything to
add? Those are all great points. I would say a lot of times it's patients who don't want to utilize amplification or hearing aids. If they have hearing loss, we always kind of counsel on why they should promote that. But some of the tinnitus patients, if they're in that mild range, they're like, I know, like that's another option that I would bring up. I have had several patients who have been wearing amplification. It hadn't been enough. And so we went into LEVO after several. They were all long-term wearers, honestly. So it wasn't like we jumped into it. We want to make sure there's a break between, using amplification versus LEVO. So I've seen resolution there as well.
Excellent. Excellent. Thank you both. I'm going to switch gears and kind of go provide an introduction into MyLevo, and then bring you back in to get a bit more of your feedback on the new platform. So let me reshare my screen. And so we have touched base on MyLevo in some previous webinars in the past, but we're happy to announce that it is fully launched and available to Levo patients and our providers. And what it is an online learning platform for patients in addition to the sound therapy that the Levo system provides. Accompanies them throughout their tinnitus journey, broken down into various parts. It provides a user guide for the patient on, for example, how to calibrate the volume correctly, what are the stages of the therapy, what expectations for the patient. Then provide some various information on neuroplasticity, or what is variability of the sound mean to me. And then give some training techniques on attention training or stress reliever suggestions, or how to identify bad habits that all can correlate to inflammation of their symptoms. So all of this is provided for them on an online platform, various learning modules that they can go throughout the course of their therapy. We have it broken down in suggested times of when they should take do the modules, anywhere from 3 to 5 minutes in length, but just again, reminders of what you're already discussing with your tinnitus patients when they go home at night and need that added encouragement. So just an example of one to see, to go through quickly. This is the example of our desensitization course, just talks about what the stimulus is and what it's like, provides just general reminders on how to become less aware and stop perceiving, and then just goes through some of these trainings for you. So again, very quick modules and reminders for the patients, not a lot of time commitment, but again, positive reinforcements and for the patient to rely on a regular basis there during the course of therapy. So as I bring back the panel with Daniel, Megan, and Kelly, I'm going to start with Kelly on this one. If you don't mind, if you can, after reviewing MyLevo, how do you foresee seeing it in your practice and implementing it with your tinnitus patients?
I absolutely love it. It's super straightforward. It's really easy and like to the point. So I always try and encourage patients to look into that. Try to do it daily for more severe patients, maybe one every couple of days. It just varies person to person, but especially when we're doing follow-ups, to make sure that they are aware of these tools, because whatever you do to treat tinnitus, you're likely going to notice a change in it. Sometimes it may get a little louder, it may spike a little bit. And so going back and circling back to the reassuring the counseling tools, I just think it's awesome to be able to have it right there. And it's just easy for them to look at and get into, even my older patients who aren't too good with computers.
Excellent, thank you. Megan, if you can get off mute for a bit. Anything to add on Kelly's comments?
Again, I love it. I think actually every patient with tinnitus can really benefit from the tools in there. One of the biggest concepts I say is you need to befriend your mind and your body. And again, the more they understand this kind of phenomena, that it often is a phantom perception of sound, and that they have the ability to be able to habituate and focus away. And you can use examples of sounds that they're hearing every day that aren't important to them. So the more the light bulbs go on, the knowledge that you give them. So this is just a simple, abbreviated way, and it's a tool that they can refer to again and again, and the listening activities to help change the focus of where you are listening to really can help and allow for even more success as the brain is rewired.
Excellent.
I'll add one more point. I also think it's great because a lot of times our tinnitus patients are the ones researching everything and they're looking at Dr. Google, and I say, don't do Dr. Google. It's not accurate. There's so much misinformation out there. So to have a clear and concise content right there, it's like, no, this is reliable stuff that you need to focus on, not all of the wish-wash out there.
Excellent. Daniel, anything to add? I know both Megan and Kelly gave
I really love the example that Kelly used of building a muscle, because when you try to build a muscle, you may go to a gym and they will teach you that there's a way to build muscle and which kind of training do you have to do. But if you go home and you don't do it on a consistent way, on a consistent manner, it's not going to make a change. So this is one of the things that we realized while we were working with patients. And when you are working with a low number of patients, maybe it's easy to keep on the pressure on each one of them. But when you have many numbers, big numbers of patients, I mean, more than 100 patients a year, as we see here in Montevideo, it's a problem because you are not able to go after each one of the patients, and you need something that gives the patient a kind of backbone of the timing of the therapy he's going to do. Also for us, for the therapists, to know that in this month you should go through this content, and in the other month, the other content, in order not to forget anything and to be able to provide the patient therapy that is really meaningful and really can achieve a change, really can build a muscle, as Kelly was saying. So I really believe that the effort that we made in creating this platform, and let me say one thing, we are just at the beginning of this platform. Those are the first 19 contents. We had a really long idea of where this can go, and we are thinking of creating contents that also address issues that the ones that Megan was saying, issues that are related to the jump. How do you say it? ATM? How do you say it in English? This articulation.
TMJ.
TMJ.
TMJ. Temporal mandibular joint.
The TMJ. Okay, we say it the other way. ATM. Okay. Things that are related also to the neck, and many things that we know that can influx on the tinnitus. Well, we are going to create specific contents for those issues, and the patient can go inside. If he has one of these problems, he gets inside like a branch of the system, and then he gets back to the main system. So this is just the beginning. We are trying to develop this in the following 2 or 3 years. We have a very, very long ideas, and we are really excited about it.
Excellent. Thank you, Daniel. I'll touch on final future, so I appreciate the segue into that conversation. But before we do, just one quick question for both Megan and Kelly. Maybe I'll start with you, Megan. Any advice for colleagues here out on the webinar today that are thinking about implementing LEVO or sound therapy or tinnitus therapy in their practice? Any advice considering the onboarding or any feedback from your end as a provider?
Sure. Well, definitely make sure you have a passion for it, and if not, refer appropriately. Definitely, you want to make sure that this is where you do a good job helping to put people at ease that are living in a place of stress and anxiety. So that would definitely be one of the things. But course education, the support that both you and Daniel provide is amazing. So, to the learning of the LEVO system and getting that support is phenomenal, but having those added other courses, whether they're from manufacturers or Dr. Jasterbaum's course, 3-day course is exceptional on TRT, tinnitus retraining therapy. So as a clinical provider, get your education, get your tools. University of Iowa has a good course. Some of the manufacturers take some of the best leading researchers in the area. So the more knowledge you have and the more tools you have in your tool bag. There's a wonderful course that Jennifer Gans gave for free over COVID and did a lot of research. And it's a mindful tinnitus. I think mindfultinnitus.com, I believe, is the website, but it's exceptional. And then as well, just educate yourself on those added areas. I feel like in this specialty area, I live a healthier life because just reading books like Why We Sleep, Unlocking the Power of Sleep and Dreams by Matthew Walker. And he's probably one of the forerunners researchers in sleep. And it really makes you understand why the Levo system can work so well because of what happens to the body, the mind during sleep. And one other book I'd recommend is The Body Keeps the Score, exceptional book, because trauma, I really believe sound can be equated as trauma. It doesn't need to be the extreme examples that this book gives as some of the examples, but it's an exceptional, powerful book that understands that we need to help. And that's why talk therapy is so important, but these educational tools that help refocus, cognitive behavioral therapy, change your routines up, really can be part of this holistic healing process.
Excellent. Thank you, Megan. Kelly, anything on your end, Dan?
Yeah, yeah, that was awesome. I totally agree. You have to have a passion for it. Do all the training that you can. I know Megan's a certificate holder in tinnitus management. I am as well. As we know, there's no golden standard for treating tinnitus. So just knowing you have all these different options. Levo's not right for everybody, but there are a lot of people that can really benefit from it. A lot of times people are like, why the heck would I want to hear the same exact sound I'm hearing at night? But when you explain the research behind the sleeping, and when your brain's able to habituate quicker, as well as, you're hearing it at the same level. So it's not necessarily like you're increasing it, you're having it at that mixing level. So just educating patients and having all these options. I'd rather have reliable options, more of them than not, because again, not everyone's the same. There's no golden standard for tinnitus, but Levo's been awesome. You guys have been awesome with educating Daniel, Matt. I know Matt's on the West Coast, I'm on the East. He's actually even texted me at the crack of dawn. I forgot he was on the West Coast, but he was awesome, was able to reach back out. So it's just been great with any questions. And I've been working with it for several years. So Matt didn't train me, but prior to, I did have great training as well, onboarding.
Excellent. Thank you both. I'm going to just give a quick recap, a couple upcoming slides, but also then open it up to some Q&A. So if you do have any questions for our panelists, please go ahead and submit them in the Q&A chat, and we'll get to them momentarily. So let me reshare. And so just to recap MyLevo, it is available currently. If you are interested in getting that link to provide to your patients, please reach out to me directly. I'll provide you my contact information here in a few slides, or you can call us on our 800 number as well. But again, MyLevo, providing that information and training for your patients in addition to your counseling efforts in office. So something to go home with for the patients and divert their focus away from their tinnitus. Again, just another tool, as both Kelly and Megan mentioned throughout the course today, having options and having something available for your patients is always nice to have. In terms of what's next for MyLevo, and Daniel touched on this earlier, what we're looking for is obviously another expansion of more audio guides and mindfulness tools, additional modules that can help with your patients. Converting this to an app-based solution where it does provide automated prompts for patients, gives you continuous feedback on their use and exposure to the MyLevo site as well. So a lot to look forward to in the coming months and years ahead for MyLevo and for Levo system in general. Short term, next month we will be hosting an upcoming webinar on acoustic stimulation, customized versus non-customized sound therapy. Dr. Rich Tyler from the University of Iowa will be joining Dr. Drexler on this upcoming webinar. So please be on the lookout for an invite here for this future event. Again, on behalf of LEVO Medical, I want to thank you for attending today's webinar, and hopefully you found the conversation positive and informative, and I certainly did. I want to thank our panelists again for joining us. Please reach out to me directly if you have any questions or want to continue the conversation on LEVO. I'm happy to schedule a demo with you and go through the programming device and just provide that overview of what the therapy and onboarding process looks like. So at this point, I'm going to ask our panelists back up on and see if I can open it up for some questions and answers. So the first question we have here says, majority of our patients have layered tinnitus. How do you recommend treating those types of patients? And would LEVO work for this type of patient? Somebody want to take a stab at that question? Megan, do you have a...
Sure.
I didn't get the question. So the majority of our patients have...
Repeating the question, so most says majority of their tinnitus patients have layered tinnitus. And what would you recommend for these type of patients, and would they be a candidate for LEVO?
So I'll answer the second part first. I would say absolutely yes. I believe with the LEVO system, you can create some layers of the signal, but I definitely always would focus on the one that's the loudest first. So that's what I would look to match the best at the start of it. But there's definitely other types of, again, if they have hearing loss, a tool that I've used well is the wide X fractal tones. And I definitely find that can be very helpful, and you can put a layer of white noise. And I like the fact that that device, you help to avoid masking the signal over time. Initially though, back in the day, there was a device where there was a relief period. So I think the brain needs relief before it can be ready to rewire. So initially, I find sometimes that you just need to find that signal that gives them relief. But yes, the answer is, I think LEVO could be a very good, pending no contraindications of degree of loss, etc. Absolutely to try for them.
I'll ask Kelly this question. From your patient's experiences, the earbuds, any comfort issues, or what is the overall feedback on earbuds with your patients in the LEVO system?
I mean, there's an adjustment period for anything. I always associate it to, like, you know, you getting a new watch. I think we all kind of have that. We talk, even if it's hearing aids. So there's an adaptation period. They're super comfortable, especially the newer version. It's definitely been much more, the older headphones were great too, but I mean, it's a very thin wire. It's a piece that goes kind of up, it goes in the ear and then goes up around. It's long enough so that if they're movers at night and they roll around, they won't really have an issue with the system. So, and there's different sizes to there's little different tips that you can fit on them. So if they're not comfortable, but honestly, I really haven't had any issues. One guy was pretty sensitive just because he was sensitive to everything, but his wife helps create this like makeshift thing with the wires. I don't know what they did, but that was just an odd one. Other than that, no issues.
Excellent. Megan, anything to add from your patient's experience similar?
Yeah, very similar. Oh, I'm sorry.
No, go ahead.
No, go ahead.
Just, I've been creative with a case where I actually used a company that doesn't manufacture anymore and had some in stock of Sevotech tips. And for this patient, I was able to be a little creative for them just because the retention was hard for those particular ears. But I think the amount of tips and sizes and lengths, but there was no issue with like sleeping with them in comfort.
Daniel, did you have something to add?
Oh, no, I just want to add that sometimes we have this period of adaptation. Sometimes it takes time, but in the long term, sleeping with earbuds is not a big issue. I mean, sometimes we explain to our patients that it's like using new shoes. At the beginning, you feel quite, you have to adapt to the shoes, but after some days, you get adapted to it. And then in the last phase of the therapy, the detachment phase, we have the opposite problem. We have to to teach our patients not to use the system because we want them to stop using it. So, I mean, the patients get so used to the system and they get so comfortable of sleeping with it that at the end of therapy, we have to do the opposite. We have to tell them, okay, stop it, use it on a nightly basis. You are going to use it 3 nights in the week, and 4 nights you are not going to use it. And after that, only 2 nights, and after that, only 1 night per week, till we achieve the moment in which the patient doesn't rely anymore on using the system for going to sleep. He only uses the system again if he has punctual decompensation. But usually what we do after 1 year of time, or after 9 months of time, is to teach the patient not to use the system anymore.
Next question I can handle regarding, are patients available to utilize MyLevo before purchasing the Levo system? Yes, absolutely. Just reach out to me directly and I can provide that link for you to share with your patients. There is no cost for the MyLevo learning program. It is included with the Levo system device and therapy that you would order. Final question here is in regards to references for independent research regarding the Levo system. So that information can be found on our website at www.levomedical.com under resources, and you will then see various studies and clinical data. One from the VA, VA data from the NCRER, where Dr. James Henry and his group did an independent study, and then as well as some additional information, clinical data in that site as well. Any other questions that I see? That is all in the Q&A. If there aren't any other additional questions, I will close it at here and give you some time back for your day. Again, I want to thank both Megan, Kelly, Daniel, or all 3 of you. Really appreciate the conversation and enjoyed the time that we had here today, and learned quite a bit, and hopefully our attendees share the same experience. So again, please reach out if you have any questions or want to continue that conversation. And I'll leave it at that, and hope to see you guys next month. So bye for now. Thank you, guys.